Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. Today, we're joined by Andy Barr. He is the founder of QuantMove to explore how smarter systems can drive better care and unlock human potential. Thank you for joining us today, Andy.
Thanks for having me on the show. Appreciate it, John.
Absolutely. And just to give our listeners context, tell us a bit about your background.
Yeah, so I'm a physical therapist by trade with a passion in movement assessment and biomechanics and injury risk reduction. I started my career in professional sport over 25 years ago, actually, as a professional soccer player in England, got injured, and then went straight into physiotherapy, where I was then fortunate to go straight out of university and work with professional Premier League teams for 10 years, worked at Bolton Wanderers, Southampton and Manchester City, more in a kind of hybrid role where I would integrate injury prevention strategies across performance and medicine. And then I got offered a job in the NBA in 2009 to work with the New York Knicks to do a similar role where I'm linking in medical performance and coaching and trying to optimize performance and reduce injury risk. Did that for 6 years before then working in the MLS with New York City FC. And then I decided to set my own business up in 2016, moved to LA, where I built the consultancy company and started my tech company, which focuses on utilizing cameras and computer vision software and sensors to help make better decisions on how we assess patients and athletes to optimize their care, rehabilitation, and injury risk reduction. And then 3 years ago, I moved to London. I still do consultancy with different teams in the NBA. More recently, I worked also in the Premier League with Chelsea, and I fly into the US once a month and do consultancy with New York Knicks, the US women's soccer team, and Washington Spirit. I utilize my technology to help advance their programs, and I'm just in the process of building the software company to hopefully scale it so everyone can get access to the stuff that I do with the elite players and teams.
Your platform out to the more of the public space as well.
Yeah, exactly. So what I noticed is at the elite level, they get access to this high level biomechanical analysis. They get access to experts. They're used to getting, the best of the best in terms of rehabilitation methodologies and experts that come in and work with the athletes. And I just wanted to create something that allows everybody to get access to that. And so I'm bringing those concepts and philosophies and ways to do these assessments to help, an everyday athlete, youth athletes, more active people get access to this type of methodology and system so they can get access to lab grade, elite level methodologies in the local PT clinic or chiropractic clinic or, whatever that healthcare setting may be, whether it's a youth academy, or, a gymnastics club, to anyone that has an interest in injury risk reduction and optimizing movement health. I want to try and, give access to this system.
That's excellent. So what is some of the feedback that you're beginning so far from the general public from using the application?
Just the high level accuracy and feasibility. I think what you often find is to get the quality of data, you need to go to a biomechanics lab to do that. And then you've got so much data, knowing what to do with it, what type of tests to do, and what's relevant, what's not relevant, all these questions, and it gets overwhelming. What we're able to do with our system is provide the same level of insight with accuracy in a really convenient locations. What people like is the ease of use because we use mobile phones, or you can ingest any type of camera data, and then we provide like the guidance in terms of analysis. And then you can also tap into our AI that is also automates the recommendations around what they should do when they see certain types of injury risk in relation to movement and the context of, that person themselves. So we try and provide the context with the software in terms of what they do from a sporting perspective, what their injury history is, put it all together and provide these recommendations around exercise strategies or interventions.
Yeah, it sounds like
the feedback is how it's really useful and convenient. Essentially, is a lot of the feedback we've been getting so far.
That's amazing because it sounds like once you can really dive into the nitty gritty details of this technology and get lost in the details, it sounds like you're trying to make it in a digestible way for people to easily understand.
Exactly. Yeah. So just they have those actual insights that make sense. And, the AI is really nice at providing the context and streamlining a lot of those processes, where as before you'd spend hours sifting through the data, trying to figure out what makes sense, what's relevant. And then what do you do about it? How do you link that information into an actionable intervention? And so we're able to kind of like give the user an end-to-end solution, which really allows them to fit in their workflow. Because often you have these systems that aren't, great for workflow, and they can take a lot of time to set up, whereas this can be quick to put into the workflow. And it can be a real boost to the business too, because it sets them apart, gives them an advantage, something unique that allows them to provide better patient care, better outcomes in terms of the quality of their assessments. And then because we have like a way to provide streamed biofeedback with the system too, they can also set the clients up with the sensors or just in front of cameras, and they can do real-time exercise and know that they're doing those exercises with the most optimal form. So it almost becomes an assistant in the clinic for a lot of the clinicians. That's what we've been told.
Sounds like almost like an assistant that's helping that person, even though they're on their own, providing like amazing feedback. And when you're working like in your day-to-day business, like where are you spending the most energy kind of right now driving your growth? Like where's your focus?
So right now I'm just exploring all the different markets. So my area of expertise has been working with professional athletes and professional teams. So now I'm just trying to really learn about what are the pain points for clinicians. How can we best make this, into the workflow, and just getting as much product feedback as possible to make it as user-friendly and intuitive as possible. Most of the time right now is just spending on product development and refining that and exploring how this can really fit into the markets, and just targeting the markets that we want to see as the best fit in the short term before we really expand into different verticals.
Yeah. And what stage are you guys at right now? Are you like pre-seed, like MVP? Or are you at the market now, but just at a smaller scale?
Yeah, so we are seed. We aim to go to a Series A in about 12 months. We're just starting to go to market essentially, and starting to get some traction with customers. Yeah, so the goal is to just start generating some traction over the next 12 months and then try to scale it into different verticals.
Excellent. And then in this industry specifically, like what's one shift that most leaders are not paying enough attention to, that you've noticed?
I think the insights that you can actually get and the quality that you can get from being more specific with this type of analysis, and how helpful it can be for the outcomes of your patients. I think one of the things that historically is a bit of a gap in the rehab field specifically is knowing when the client or the patient is ready to return to function or return to play or return to sport or activity, and having more of an objective pathway to allow better guidance of that process. And I think people now are appreciating the benefit that has and the importance of that, because previously in the past, when a client, a patient, or an athlete is returning to function, historically you're looking at range of motion, you're looking at strength testing, and you're looking at levels of pain. And once those things are cleared, generally they're able to start going back to activity. But just because those things are ready doesn't mean that they've got the appropriate coordination or strength capacity to allow them to cope with the demands of whatever their activity is. So what we're seeing now is more attention being paid on some of those real important factors. As injury risk is a big factor, and it's too common that athletes are re-injuring their ACL or their other leg. And it's often because they just haven't had the appropriate care on that return to function or return to play. And there's some crucial and some key things that can be identified using the software that we've developed that can help reduce that risk and provide better guidance on when that person is ready to return to the sport specifically, or whatever the hobby or activities are, or the functional requirements that they need to have. So being more aware of risk factors and things that can increase the risk of re-injury is becoming more commonplace, and just being more diligent in that return to play process.
Yeah, more specific to your company as well, how have you adapted to this? You called out the ACL example. Is there anything specific that you're focused on to preventing risk of injury again?
So yeah, there's key movements that we will dive into that relate to injury risk factors that we can identify with our system specifically. So especially around the trunk, I think one of the things that is often overlooked is how the trunk moves in relation to the rest of the body, and the center of mass specifically. So one of the things that we are quite focused on is how the center of mass is transitioned into different directions when athletes or clients are performing different types of action. And if that center of mass isn't moving in an efficient direction, then that can change the torque in the knee. So, for instance, a 90-degree cut is a common return to play test. And what we often see is the way that that is executed in a more efficient way is the control of the center of mass generally goes in the direction of, the 90-degree cut and the movement that we want. But what you see sometimes when there's more risk is you get a inefficient center of mass motion, and that comes from too much side bend on the trunk in the opposite direction that you need to go. So just being able to identify how the trunk moves and then the stiffness of the knee in certain components of the deceleration, usually the penultimate or the final step. If that doesn't have enough flexion and there's excessive flexion or side flexion in the trunk, then that really ramps up that risk. So just zooming into those like movements really helps, reduce the risk and improving the way and the strategy that athlete may coordinate their movements is something that we really try to focus on to help reduce that risk of injury for the ACL.
Yeah, it sounds like it's almost like a form of test to see if they are able to get back to their normal activity. Is that in the way what you're talking about?
Yeah, so you have, there's normal and there's ideal, right? So like somebody might have not been, their normal might not have been ideal in the first place. You can always obviously compare the healthy or uninjured leg to the other leg and the different asymmetries moving from left to right. But usually if there's a poor coordination of movement, that might have been there is often before they even injured the leg. So detecting that type of coordination of movement before they return from their injury is really important. And that might just save them from injuring their other knee as well as re-injuring their knee. So detecting these coordination faults that are abundant in the literature right now and commonplace is really important. So there's a plethora of information out there in terms of high risk related movements that relate to knee injuries, and often people kind of just zoom into the knee itself and try and just strengthen the knee. But as I said before, it's like what's going on above the area, the hip and the trunk can really influence how the knee moves, as well as being able to absorb that strength, that motion through the knee. It's just as important to be able to control the trunk movements and the ability to coordinate the center of mass in the direction that you want to move into.
And making sure they're working in the correct way that they were intended to.
Yeah, in this instance, for sure, it's really important to look at how the body moves as a whole, and is it moving in the most efficient way? But the nice thing about our system is it allows us to provide insights at every stage of the rehab process. So you can zoom into just the knee joint and look at range of motion, or you can look at balance and get objective data to see whether the user or the patient is reaching the benchmarks that you set and reaching the criteria that you set objectively at that stage. And then you can have more of a criteria driven process at every stage. So you can have more of an objective assessment on someone's hop tests, which are commonplace usual for rehab for this type of injury. If we're talking about ACLs in like a mid stage, and then you can do more objective assessment at the end stage too. So every level, you're just getting more guided objective analysis, and then you can see as a practitioner if what you're doing is actually having an effect on the things that you know they need to be able to do before they move on to the next stage, rather than just relying on feel and your subjective assessment or your practitioner eye. As historically we've done, we can get a little bit more precise with what we're doing, and then that gives the patient and the client more confidence that when they are returning, everything's been done much more scientifically, objectively, and precisely, so they can return with more confidence too.
Yeah, that makes sense, especially in this day and age with data and analytics and showing people that it's not just me saying you're getting better, you actually are getting better, and showing them that data, I'm sure
Yeah.
over time. Yeah. And like when you're looking at your business, like your day-to-day operations, like where do things feel clunky or like slower than you'd like to see when you're working?
I would say what feels clunky and slower. I think, sometimes I get spread thin because I've got so much going on and trying to just keep up with everything. The administrative work is tough at times. I think just being able to respond to every email. We're obviously right now, fundraising too. So being able to keep up with the communications around fundraising, just the day-to-day operations and making sure that the business is operating smoothly, that we're making sure that we keep relations with our customers, that we're doing our best for them. It's just for me right now, as I'm in this growth stage, it's just a lot of moving parts. So for me, it's just trying to streamline that and be as efficient as possible and not get too spread thin. And with the amount of opportunities we have and the different verticals that we could go after, just staying focused is a real thing that I need to like be aware of and try to be at all times, because I can get distracted and go off and on a tangent, start like thinking that this is another great opportunity, but it's like, let's just try and nail
Yeah.
this area.
Yeah.
And we are still so new, we're exploring different verticals, but what we've got to try and do is like really stay focused on the ones that we believe in right now and test the market.
Yeah, that makes sense. And just double down on that, right? Once you figure out what's working.
Yeah, exactly. Yeah.
And
Figure out
like,
how we can provide most value to our customers.
yeah, when you're working with your customers too, like through the app that you're working on, how do you handle things with like retention and keeping people engaged on the app? Like, how do you do that in your world today?
I think just customer service and relations, that's something that we really pride ourselves on. So we really try and guide the practitioner as much as possible, provide them as much support as they possibly can have to ensure that we get that stickiness with the product and that they really start to put it into their workflows and get the best out of it. So I think our support is key to that. And we have a VP of customer experience who's really provides a lot of attention around that. And we have a lot of touch points with the customers and make sure that they get onboarded well and that they know how to use the system really well, and that we provide them with the best protocols, videos, information, everything to support them to make sure that they get the best use out of the product.
Where do you notice, like, when you're just a curious question of mine is like when you're working with your clients and your customers that are not professional athletes, where do you find that they kind of fall off in the process, or they lose engagement, or there particular sticking points?
I mean, right now it's probably just the practitioner making sure that they're using it diligently and that they remember to use it, because they have their old way of doing things and they get comfortable doing it a certain way. So just kind of changing their mindset that if you apply this new technology into your workflow, it can actually make your work easier than harder. You can do more with the patient and you can get more quality out of them. And there's often when they're working with a patient and trying to ensure that they've got the best form, there's things that they're not seeing, whereas this will allow them to improve the quality of their outcomes. So just changing the mindset a little bit of how they should, if the more frequent they can use it, the better outcomes they're going to get. So it's just being consistent at every stage. I would say it's like just the learning point. And I think that's part of us just developing the product and making it as user friendly as possible to allow them to not have that feeling of, I'm only going to use it a couple of times through the rehab process, as opposed to using it nearly every day.
Yeah, it's a habit, right? They got to develop the habit. Got to keep engaging them, and I completely understand that for sure.
Yeah, exactly.
And like, for example, looking at like current results and bottlenecks that you may be encountering, like, let's look at the positives. So like, what's working really well that you would never want to lose right now in your business?
I think what's working really well is the fact that we're able to make such a good impact, like straight away, like really show a difference. I think the fact that we can provide our customers with such high quality information in a convenient environment, in a convenient situation, is something that they get like kind of wowed by. And then there's so much more that we want to do in the future, which we're building towards, where we're integrating, like I said before, more AI recommendations and like even more intuitiveness as we start to build through our machine learning process. But I think what's working well is just the initial insights that the practitioner is able to get that they wouldn't normally get from the type of assessments, and the way that they can see in real time the improvements and the feel that the clients get when they realize that they're doing something in a form that is different to what they thought was good, and they can actually see it and make quick change. So for instance, we had a client recently that we were doing a biofeedback session with, and the client thought that they could do this squat really well. And every time they squatted, they were shifting their pelvis and losing the control of their lumbar spine. And one of the issues was a lower back problem. So when they could see that in real time, what they were doing, and the sensitivity of the sensor allowed them to detect that, and they could feel and see and get that external focus. And then they started to use the muscles that they couldn't really use when you're trying to communicate that without the system. So then being able to feel that was super cool to see. And we've got so many success stories around that. So just having that, immediate feedback and then being able them to like make that immediate change is something that's really cool.
Yeah. And so like I'm trying to understand the process too. So you're using the app, and as the prospect is using it, or the client that's using it on the application, are they getting like recordings of themselves and then they get feedback and re-record again? Is that the iteration process to improve?
So there's two components to it. So there's recorded component where you can review a video of yourself doing something, or there's a live stream where they can see in real time what they're
What's
doing.
happening?
So as they
Wow.
move to the left, they'll
Yeah.
see it in the screen. And if the goal is for them to maintain equilibrium and stay centered, then they can do balance exercise and see whether they're staying centered, or if their goal is to do like a squat and keep them lower back in a more neutral position, they can see, am I keeping it in a neutral position? And then I can correct it in real time and make changes in real time. So any exercise can be improved in real time rather than having to like look back at a video and see the quality and then hope that they can do it. They're getting that feedback in real time. And that's the beauty of it. That's what they really seeing that benefit and feeling it in real time. So it's kind of, you've got the assessment, which is a recorded situation, but then the training part is where I think is game changing.
Yeah. It sounds like it's a two pillar
Yeah.
vertical. That's kind of what you're looking at there. So that's excellent. And then opposite end of the spectrum, what's been harder than expected, despite all the effort that you guys been putting into it as you've been kind of going through this process?
Oh, I mean, it's what's been harder than expected. It's all been hard. Like it's having a startup, having a family, running, a business, trying to generate revenue, keep things going. You got to have a certain type of personality to just stick with it and just believe in the process. And technology isn't always favorable. It breaks. You get bugs in the system. Just trying to make sure that you have a product that is working. You have the idea, like trying to integrate that with building an application, making sure you have the right team, the right people. So there's just so many things that are challenging. But fortunately, at this stage, I've gone through so much. I've got a great team of people that know what they're doing. But initially, like 4 years ago, when I started this journey, I was on my own. It was a lonely place, and trying to do that, trying to make it work, trying to build the team, it was challenging, but I've had some great backers, got some really good investors behind me. I'm blessed with who's involved in the company right now, and we've put together a really good team. So we're getting some great traction and momentum, but it's ups and downs. There's a lot of emotion. Like you have some really great days where you get a lot of wins, and then you have other days where you just like nothing seems to be going right. So it's just I guess the journey of an entrepreneur.
Yeah, it is. Unfortunately, it's a up and down process, and
Yeah.
even throughout the day, you can have really good moments and really bad moments. So
Yeah,
just hopefully you land on a good one at the end of the day, right?
exactly. Yeah.
Yep. Yeah. And if you solved all these bottlenecks, what would success look for you in 6 to 12 months? Where do you want to go?
Yeah, I think if we could be in, over 200 physical therapy clinics in the next 6 to 12 months, I would be absolutely delighted. If we can be helping, over 1,000 patients recover from injury and reduce injury risk, I'd be absolutely delighted. The more people that I can get using the app, the better. So I just want to get it out there to as many clinics, testing it, trialing it, and utilizing it so we can really help facilitate, the great things that the app can do for them. So that would be, a great successful 24 months if we can really get into at least, 150 to 200 clinics.
Yeah, that would be amazing. And I'm sure you would see dramatic results as well. Again,
Oh,
especially
yeah,
all the feedback you'd get from all your development work. So,
exactly.
and even beyond like that, beyond 12 months, say you're able to do that, meet that goal, what would that free up for your team to focus on next? Like, what's the next best thing?
Well, we've got different verticals. So I think, initially we're definitely working with pro teams and colleges, but then our main focus outside of that is clinics, PTs, practitioners, chiropractors, but then also youth academies. So having more of an impact on youth sports that might not necessarily be sports, maybe like the military or, care facilities. There's just so many different verticals that we can apply this technology to facilitate optimal rehab and reduced injury risk. So I think just growing it into different segments, different sectors, and taking it more global. We've got different partners around the world to tap into. So right now we're just mainly focused in the US, but then in the future, I think after this next 12 months, we want to try and take our learnings and insights into different verticals and just grow and scale. And that's where we'll be going for our funding in Series A in 12 months' time to help us do that and accelerate that pathway.
Yeah, it sounds like you're well on your way and you've been making amazing strides, and I salute you for that. I know that's not an easy task to accomplish. So
Thank you so much.
you're welcome. And then where can people find you now that we're at the end of the podcast? Like if they want to connect with you, learn more about what you're doing and what you're up to.
Yeah, so my email is andy@quantmove.com. That's QuantMove.com. So people can email me there. The website is quantmove.com. I've got my Twitter and Instagram is Andy Barr PT. So they're all the ways that people can reach out, DM me or send me an email.
Excellent. Well, thank you for your time today. It's been a wonderful discussion.
Thanks for having me, John. It's been a pleasure.